What's going on, everybody? Tom Walters here from Rehab Science, continuing our biomechanics lecture series. This is lecture 11. So if you've missed the ones before this, make sure you go back and check those out. You can kind of watch them independently, but make sure you hit those other ones. So this will probably be the last lecture of the series. I may look at some of the other ones that I did from time to time, but this sort of is the last one of the sort of main lectures I would do over a normal semester. So previous to this lecture, we did lower extremities, so we looked at the hip joint, the knee joint, the ankle joint. So if you haven't watched those can be really helpful to review and to learn the biomechanics of those joint regions before we get into the gait cycle. The human walking cycle or gait cycle is what we're going to look at today, and obviously knowing sort of normal mechanics for the hip, knee, and ankle is a really helpful foundation before you get into gait. So all right, well, this is one of my favorite topics. Human gait is kind of cool in that it's one of the few areas of human movement that we have normals for. There's sort of, all of us walk in a pretty normal way. We move our joints through kind of similar movements, similar range of motion. We use similar muscles, and obviously there's pathological gait situations. You might think of somebody who has cerebral palsy, or someone who's had a stroke or a brain injury. Obviously gait can change. So, or even when you're injured, right? If you just have pain, maybe you've strained your hamstring, or you have knee arthritis. Those things are going to affect the gait cycle if there's pain. So pain can change our gait cycle, and so knowing what normal gait looks like can be really helpful because it can help you identify abnormal situations. And when you understand the mechanics of gait, you can understand what impairments are happening and are existing in someone's gait cycle and what you might do to help improve their gait. So it's really important for us to have, as close as we can, to have a normal gait cycle. When people are injured, they often walk more slowly. If you have major gait deviations, it can affect how you function and just your ability to participate in things out in society. So it's a really important area and a very just basic human skill that most of us take for granted until we're injured or have had some problem come about. So we'll go through and just, there's a lot to gait. It seems pretty simple, but it really breaks down into these different phases and events. And I think this will help you understand and just break it down. You'll be able to watch somebody break it down into these different events and try to figure out what's going wrong. So all right, well, let's jump into it. So when we think about gait, just from a definition, it's the rhythmic alternating of the upper extremities and the lower extremities, basically in order to create forward progression, right? That's the whole goal, is movement. So gait helps us move forward. And here's a biomechanics video that I shot back at a clinic I used to own. And this is how we'll usually analyze gait, is from this side view, because gait mostly occurs in the sagittal plane, that forward and back plane. So, it has these flexion and extension movements. And obviously her arms aren't totally normal in this video. We had her bend her elbows so that her arms wouldn't cover the marker on the hip, because then you can't record the joint angle. So normally the elbow wouldn't be held at 90 or 100 degrees like that. The arms would be down at the side, and we get this rhythmic alternating movement of the upper extremities and the lower extremities. So this gives us just kind of a quick snapshot. This person was healthy, not injured. This is kind of what normal gait would look like, and we'll go through and break this all down. Some of you might notice she's going backwards on the treadmill. This was a kind of a special treadmill we had to analyze gait, so they could walk forward and we could get their left side, and then they could walk backwards and we could get their right side. So pretty cool treadmill. All right, so looking at goals of normal gait, we mentioned forward progression. That's a huge one. Shock absorption. Normal gait allows us to use our neuromuscular system, to use our muscles to really absorb shock, especially the glutes, the quads, and the ankle dorsiflexors. All are going to be really important in absorbing shock. Lower quarter mobility. We'll look at the angles that are needed at our hip, knee, and ankle to achieve normal gait. Stance stability is a huge one. We'll talk about gluteus medius, our hip abductors, how important they are. There's always a period in the gait cycle where we're standing on one leg. It happens quickly, but we're standing on one leg, so we need stability there. And energy conservation. Really, energy conservation is one of the biggest goals when you're working with somebody with a gait issue, because when people have pain or some pathology that's leading to gait problems, they spend way more energy and it can be exhausting. So understanding what the normal gait cycle is and getting the person back to that can really help them conserve energy. So those are the major goals. When we look at the gait cycle, we're going to break it down to two phases. So one is the stance phase. This makes up about 60%. Some references will say 60%, some will say 62%. So it's about we're going to go with 62% of in this lecture of the normal gait cycle. So that just means you're standing on the leg. So we're always going to be looking at one leg at a time, and it's going to be the leg that's closest to you because it's not being obstructed by the other leg. So that leg you'll be standing on that leg for about 62% of the gait cycle. And then the other part, the other phase is the swing phase, and that's when the leg is swinging for the next step. So we've got stance and swing. And then a full gait cycle, just from a definition standpoint, is the time between contact to contact on the same foot. So again, if I'm standing and looking at somebody from the side, maybe I'm looking at their left leg, a gait cycle will be when that left foot hits and then when it hits again. So most people have a heel strike. In terms of walking gait, a heel strike is usually the first point of contact. So it would be a heel strike on the left foot to a heel strike again on that same left leg. That is a full gait cycle. The gait cycle is also referred to as one stride, or two steps, you can think of it, right? A left leg step, my left leg steps, and then my right leg. That's one gait cycle or one stride. In a normal healthy gait pattern, this is about 1 second. So most people will complete a full stride in about 1 second or one gait cycle in about 1 second. So now we're going to break the two phases down into their components. So the stance phase has 5 events. These are going to be initial contact, loading response, mid-stance, terminal stance, and pre-swing. So those are our 5 events in stance, and we'll show images of these so you kind of have an idea of what to look for. So you might also see, just to note, some references out there will use terms like heel strike, foot flat, loading response, and toe off. So if you see things like that, just know there are some references that will use some different terminology. Most will use the ones I've got up here: initial contact, loading response, mid stance, terminal stance, and pre-swing. So those will be what you'll see most of the time. Okay, so when we look at initial contact, this is the first event of the stance phase. I've got an image here from the side which shows kind of what you would see if you were analyzing somebody. So as I said, most people, and this is where we'll always, if you're analyzing someone's gait, this is where you want to start, the first event of the stance phase. So you look for when are they first hitting the ground and what does it look like? In a healthy gait cycle, it will look like this. They'll tend to hit with their heel. Heel striking is the most common area of contact when looking at a normal healthy gait cycle. So, and that's what we see here. She's contacting with her heel. So it's really the moment contact occurs with the ground, and again, it's usually heel contact. Now this is healthy, right? So you might have someone who, for whatever reason, maybe they had a knee injury and they can't extend their knee all the way. Maybe they, had knee surgery, they can't extend all the way. Maybe they've got some issue with their ankle dorsiflexors and they can't hold their foot up in this position. So you may see situations where they hit their foot flat. So it's a good spot to start looking for how are they contacting. Are they getting that heel strike? What's the angle of their knee? What's the angle of their hip? And I will give you all the normals for these angles later in the lecture. Okay, so initial contact is the first event in the stance phase. Then we go to loading response. So initial contact is just a moment in time. It's that first moment they hit the ground. With these other events, we'll see that they take up a percentage of the gait cycle. So loading response takes up about 10 to 12% of the gait cycle. This is where we're transferring weight onto that limb. So you see here, her left leg, it was straight at initial contact. Here it's absorbing shock, right? That's one of the goals of gait. Her quads are contracting eccentrically to absorb that shock. You can see her foot is flat on the ground now, so her ankle dorsiflexors were contracting eccentrically to lower her foot to the ground. Okay, so these images represent the end of this phase. So we had we had initial contact, and that right after the foot hits the ground, we start going into loading response, and then this would be the end of loading response where we see the knee is in a position of flexion and the person has absorbed some of that shock. Okay, so then from loading response, we go to mid stance. Mid stance is identified by this position where the joints are all pretty much straight on top of each other. So the lateral malleolus is in line with the lateral femoral condyle, which is in line with the greater trochanter, which is in line with the acromion. So this may be just slightly off because of trying to have the arm not block the hip marker, but that's kind of what you'll see, is that these are all in alignment. And you can see this is the first point where she's standing on one leg. So this gets back to that gait goal of stance stability. So right here, she's got to be using mainly her hip abductors on this left leg, gluteus medius and gluteus minimus, to keep her pelvis level and to maintain stance stability. Okay, so definition-wise, the body progresses directly over a single limb. Okay, so we go from mid-stance now to terminal stance. And this is right before the leg we're not analyzing hits the ground. So this leg is still in the air, so we're still on one leg. The muscles on this left leg are having to control and provide stability. And you may have heard walking is essentially a series of falls. So this is where we're falling forward or falling into that next step, and the muscles on the left leg, in this particular example, are having to control this forward progression so that we don't just collapse and land on that next step too harshly. So the body's progressing over this limb. Weight is transferring to the forefoot. So on the leg we're analyzing, we were flat on the foot in mid-stance, and now we're going forward onto the forefoot. We'll see later that the calf muscles are hugely important right here for they're contracting eccentrically and controlling this movement onto the forefoot and onto the other leg to take the next step. Okay, so that's terminal stance, and then we come to our last event in the stance phase, which is pre-swing. Now we're back on two legs, so we've got weight on this other leg, and this leg is just about to come off the ground and go into our swing phase, that second phase of the gait cycle, but this is pre-swing. The toes are in dorsiflexion. The big toe needs dorsiflexion right here to be able to bend and allow us to get into this sort of push-off position, to push off over onto the other leg. So this is really, we're taking weight off of the leg we're analyzing. So in this case, her left leg is being unloaded and she's loading the other leg. So the leg we're not analyzing is really in loading response. You can see her knees bent. She's accepting load on the right leg while unloading this left leg and pushing off. So this is the last event of the stance phase, and this is called pre-swing. Okay, so this, and then it's important, there's the toe off is a moment we talk about, kind of like initial contact, like the heel strike. Toe off is this last moment right before you push off and begin the swing phase. So maybe one frame ahead of this, her toe is going to push, she's going to push, and her toe is going to come right off the ground. The instant that toe comes off the ground, that signifies toe off, and now the swing phase starts. So here again, you can kind of start looking for those, right? So now this video might make a little more sense. We can start looking at the stance phases. So you can see right where she hits initial contact. And this is why with gait analysis, you really have to slow it down, because even this video is almost a little too fast to see all these things. So you can see though where she hits, she heel strikes, moves into loading response, mid stance, terminal stance, and then pre-swing where her toes bend and she pushes off. Okay, so you can start to see some of those stance events coming out now. So then we move to swing phase. Swing phase is a little bit easier. It's only got 3 events. We have initial swing, mid swing, and terminal swing. Okay, so initial swing, you remember we ended with pre-swing in the stance phase. Pre-swing, the foot was still on the ground, and then we had toe off. Now in initial swing, the leg is starting to swing to come forward to take the next step. The way you can identify initial swing is that the shin here on the leg we're analyzing is sort of cut in half by the other leg. That leg we're not analyzing is in mid-stance. She's standing on her right leg only, and the shin of the leg we're analyzing is sort of cut in half by this other leg. Okay, so that is initial swing. The femur the hip muscles, the hip flexors especially, are pulling that left leg forward so we can take our next step. And then we go to mid-swing, which is denoted by a vertical tibia. So here the knee is still bent, the hip is flexed, the knee is in flexion, the ankle's relatively neutral so that the foot doesn't catch the ground. We don't want to trip there. This happens to some people with dorsiflexor paralysis and drop foot. Their foot will catch on the ground here. So we want our dorsiflexors to contract isometrically and hold our ankle in neutral so we don't catch the ground. And again, mid-swing, we note it when the tibia is vertical. You can see she's getting closer to taking her next step. And then terminal swing, we see that the knee is fully extended. This is the hallmark of terminal swing. The knee is fully extended and the heel is about ready to hit the ground so that we can start the stance phase over again. So this is the moment right before the heel hits the ground. So terminal swing is right in that spot. If we go forward a frame or two, we'd be back at initial contact and that next heel strike. Okay, so that takes us through the 8 events of gait. I know I went through there pretty quickly, but we've got initial contact, loading response, mid stance, terminal stance, pre-swing, and then initial swing, mid-swing, terminal swing. So those are our 8 events, 2 phases, stance phase, and the swing phase. So these can take a little while to learn, especially if this is your first exposure to it. So just go back through this first part of the video here and you can watch through these phases and events a few times to get it down. And maybe maybe there's a way I can provide this PDF. Oh, here, so this is abnormal gait. I just like to show this one. This is someone that I saw in the past, and you might notice, see if you can figure out for a second which leg is the problematic leg. So look especially as he goes into loading response. Okay, so if you're watching closely, if you watch his right leg, watch his knee, see how it hyperextends when he puts weight on it? It doesn't bend, it sort of pops backwards. Do you see that? So this individual has multiple sclerosis and has difficulty controlling that right leg. And so you can see that his loading response is abnormal. He basically hyperextends his knee and has a difficult time using his quads to help absorb shock. And you can see on the screen here, this treadmill is a pressure is a force plate instrumented treadmill, and so you can see it gives these pressure maps as he contacts the ground. Okay, so just one, there's lots of things that can happen in gait. This is just one example of, it almost looks like he's limping a little bit. So again, gait is really a useful thing to study because we quickly see people when they have abnormal gait patterns, and knowing the mechanics of gait allows you to analyze their pattern, break it down, and figure out what might be going wrong. So this is a PDF normally. This is one maybe I'll be able to share it down below in the video normally it's a PDF, so but I'll see if I can figure out how to share it. This is a neat way to break down just a single sheet to break down the whole gait cycle. Again, stance is about 60%, swing is about 40%, and then this breaks down all the events. The only thing it doesn't show here is initial contact. So, and then you're going to see some other subcategories that I didn't mention before, which are double limb support and single limb support. So when we're in the stance phase, it just basically means is the person on 2 legs or 1 leg. Okay, so in loading response, they're on 2 legs. This leg that we're analyzing is absorbing shock. Both legs are touching the ground. Mid stance and terminal stance are the 2 I mentioned before where we're only standing on the reference limb. This is where our hip abductors are working hard to keep our pelvis level. And then right before stance ends, we're back at pre-swing and on 2 legs. And then during the swing phase, of course, we're on 1 leg, but we're not going to talk about double limb and single limb support because we're into swing phase and not in the stance phase on the leg we're analyzing. So just a way to break it down, stance and swing, 2 phases, and then we've got all these events down here that make up the gait cycle, and it shows about what percentage those make up of the total gait cycle. Okay, so just a really handy kind of summary of everything we've talked about up to this point. Now we'll break down into functional categories, and there's 3 of these categories. The first one is weight acceptance. This is the shock absorption phase of gait. it really includes initial contact where the heel hits and loading response where the knee is flexing to absorb shock. So both legs are on the ground and we're quickly absorbing shock with the leg we're analyzing. Okay, that's weight acceptance. And then we have single limb support, which I mentioned before. This includes mid stance, where all the angles are in alignment, and terminal stance. But in both of these, we're standing only on one leg, the leg we're analyzing, and so our body is having to stabilize and control our forward progression on that left leg. So that's single limb support. And then we have swing limb advancement. This is the last functional category. It includes one event from the stance phase, which is this pre-swing. So the leg is still, we're still in stance because it's still touching the ground. And then all of our events in swing, initial swing, mid-swing, terminal swing. All of those together are called swing limb advancement. It's easy to remember because they've all got the word swing in them. So if you just remember it that way, that's the easiest. But all of these have the goal of advancing the limb so we can take our next step. Okay, so just a way to break gait down into three functional categories. And I just this is kind of a summary just to put it all together. So the main bullets here are the functional categories: weight acceptance, single limb support, swing limb advancement, and then all the events that go in those. So weight acceptance would include initial contact and loading response. Single limb support would include mid stance and terminal stance, and then swing limb advancement again has all of the events that have the word swing in them. So just a way to take our 8 events that we started the lecture with and put them into 3 functional categories. Okay. Just a few distance and time variables just for you to know. So I mentioned before, stride time or one gait cycle is about 1 second. So we already talked about that one. That's IC stands for initial contact. So this is from initial contact to initial contact on the same foot. So again, if we're measuring the left side of the person's body, it's when their left foot hits and then when it hits again. So stride length is again from initial contact of the heel to initial contact of the heel. In a healthy gait cycle, if they have something pathological, they might not be hitting their heel. But this ranges from 1.2 to 1.9 meters or 4 to 6.5 feet. It's a pretty big range, but that's going to depend on how tall the person is, how long their extremities are. So, you can think someone really short is going to have a shorter stride length. Someone really tall with long legs is going to have a longer stride length. So that's why you see this large range. Step length is just one step. So it's going from my left foot, my left foot hits and then my right foot hits. So it's basically half of a stride or half of a gait cycle. So you're just basically taking the length of a gait cycle and dividing it by 2. So it's initial contact on one foot to initial contact on the opposite foot. So left foot, then right foot. And our step width is the distance covered in the direction perpendicular. So if we're moving forward, it's the direction perpendicular. So basically, what's the distance between the width on the ground that we'd cover as we move forward? And it's pretty small. If you watch people from behind, their feet actually come very close together when they walk. So it's only about 3 to 4 inches of width that people are taking up when they walk, when you go from kind of inside of one foot to inside of the other. And then distance and time, other distance and time variables, we have cadence. That is our step rate, and this will vary a little bit between males and females. Males will tend to be about 108 steps per minute, and females 116 steps per minute. Velocity is the one that really is measured quite often in rehabilitation settings. So we will look at, because this 80 meters per minute really matters in terms of things in life. So for instance, traffic lights, when you think about when the walk signal comes up, you need to have about 80 meters per minute. The time that it gives you to cross the intersection is based on normal gait velocity. So if you don't have normal gait velocity, you're having to walk more slowly because of a disease or an injury, it may be hard for you to cross an intersection in time, which can ultimately limit your ability to participate in normal society. So it's just one example where improving someone's gait mechanics and efficiency and speed can help them participate in the community more and more easily. Gait velocity is just for other things, 80 meters per minute for walking, things like shuffle, stroll. Some of these are kind of funny. Uh, what exactly is a shuffle and a stroll, but maybe the other ones, like a jog is about 200 meters per minute, or if you're looking at a 7.5 mile per hour jog. Running up to 11 miles per hour, we could say is about 300 meters per minute, just to give you a reference at how those compare to a normal walking velocity. Okay, so these next few slides are, I know there's a lot of information, I'm going pretty fast, but this is where we're going to start looking at joint angles, and I'm going to be throwing a lot of numbers at you, so just go back and review this. It's not something you're going to remember most likely in one time through this, so you'll have to go back and review it. But so when we look at this weight acceptance phase, or this weight acceptance functional category, we're going to look at the events within that. So initial contact. In a healthy gait cycle, we have a heel first contact. In terms of range of motion, the hip is at about 20 degrees of flexion in most people. The knee is in neutral or 0 degrees, and the ankle is in 0. So 0 degrees at the ankle is neutral, and that means 90. So in orthopedics, we call that 0, but if you actually put a goniometer and measured it, right, that's about a 90-degree angle. So 20 degrees of hip flexion, 0 degrees of knee extension, and a neutral ankle or a 90-degree ankle. That's what we will most typically see at initial contact. And then in terms of muscle activity, when we go from initial contact to loading response is where that knee bends and we absorb shock. This is the activity we're going to see in the muscles as we go between those two categories. So in terms of the hip flexors, we're going to see minimal activity. What we're really going to see are the knee extensors or the quadriceps and the ankle dorsiflexors on the front of the shin. Both of these are going to contract eccentrically where the muscles are getting longer. So if you imagine when you land on the ground, your knee is straight at first and then it slowly bends to absorb shock. In that situation, our quads are contracting eccentrically to control knee bend to absorb shock. At the same time, when we hit the ground, we're on our heel. And to move forward and let our foot go flat, we need to use our dorsiflexors to contract eccentrically to slowly put our foot down flat. So both of those are eccentric contractions where the muscle is contracting, but the fibers are getting longer. Okay, and this confuses people a lot, so just, if you get stuck here and kind of hung up, feel free to ask questions in the comments. These sort of muscle activities can be hard for people when this information is new. So then we get to loading response, and here the knee is flexed and the foot is flat. So this picture, I forget, it's a little wonky there. So when we go to loading response, the critical event here is controlled knee flexion. So remember, we just said a second ago the quads are contracting eccentrically to allow the knee to bend in a controlled manner because gravity wants our knee to just collapse and buckle. So our quads, our knee extensors are going to contract, get longer to kind of slow down that movement and control it. So when we look at the range of motion, we're still in 20 degrees of hip flexion. Now the knee is at 20 degrees of flexion. It was at 0 when we hit the ground. Now it's bent 20 degrees. And the ankle is no longer at 90. It's moved through plantar flexion. So we lowered our foot to the ground. So we're not at that heel strike anymore. Now we've lowered it to the ground. We've allowed it to move slightly into plantar flexion, past neutral 10 degrees. Okay, so again, critical event here is controlled knee flexion, which is how we absorb shock in loading response. So now we're going to move from loading response to mid stance. Remember, mid stance is where the body is in a straight alignment and we're on one leg. So to go from loading response to mid stance, we've got to sort of vault our body forward. So what's going to happen is our glutes, our hip extensors are going to contract concentrically. Our knee extensors, our quads are going to contract concentrically. And our ankle dorsiflexors are going to contract concentrically. All of those, our muscles are contracting and shortening to help pull us forward. So our glutes are going to contract and pull our hip into extension. Our quads are going to contract and pull our knee into extension. And our dorsiflexors are going to contract concentrically to pull our tibia forward into more ankle dorsiflexion. So it would look like this, right? So now we're in this position where the body's straight. The hip is now at 0. Remember, it was at 20 degrees of flexion, so now it's extended to 0. The knee was at 20 degrees of flexion, now it's back to 0. and the ankle is in 5 degrees of dorsiflexion. So remember, a second ago it was in 20 degrees or 10 degrees of plantar flexion. Now it's in 5 degrees of dorsiflexion. The ankle has moved about 15 degrees. And that happened by the ankle dorsiflexors, mainly tibialis anterior, pulling the tibia forward so that we're into dorsiflexion. And again, that makes sense. The critical event is controlled tibial advancement. So our tibia was back behind a little bit. You can see here, the tibia is back behind a little bit. These guys are going to contract, and that's going to pull the tibia. Now you can see the tibia is sort of tipping forward. So that's tibial advancement. Okay, I know this is a lot of stuff, so just go back through these slides a few times because it's a lot of numbers here. So now from mid stance to terminal stance, in terms of muscle activity, we don't see a lot the hip. We don't see a lot the knee. The biggest one, this is the largest torque demand in all of Gait, are the calf muscles. So our ankle plantar flexors are contracting eccentrically. They're contracting but getting longer to slow us in that fall. Remember, this is where we're falling in the gait cycle towards the next step. Our calf muscles are what control this. So this is where the person is tipping forward. She's in terminal stance. This leg hasn't hit the ground. It's getting close to hitting the ground. The calf muscles are really contracting hard, are working very hard. Like I say, it's the largest torque demand in all of Gait. And so it fits, controlled ankle dorsiflexion. So what happens is people will think, oh, if she's going in a dorsiflexion, it must be that her dorsiflexors are contracting. No, she's falling into dorsiflexion, so her calf muscles have to contract eccentrically to control that movement. So this is where the muscle activity gets really tricky for people who are new to these. To these kind of movements, you can't just look at what the joint's in. You can't just look at this and say, oh, she's in dorsiflexion. That means her dorsiflexors are contracting. No, in this case, gravity and her momentum is pulling her forward into dorsiflexion, so she has to use her plantar flexors to control that. So now we've switched to the opposite. We're in 20 degrees of hip extension. Remember, we started the gait cycle in 20 degrees of flexion. The knee is still at 0, and our ankle has moved into more dorsiflexion. This is the maximum dorsiflexion we see in the gait cycle, which is 10 degrees. So it's why we a lot of times in rehab work on ankle dorsiflexion mobility, because you need at least 10 degrees of it to walk normally. Okay? So from terminal stance to pre-swing, we don't see a lot of muscle activity at any of the joints. The leg is just kind of moving behind us because of our forward progression. The muscles kind of turn off, and it's just the ground pulling our leg behind, causing the knee to bend. There's not a lot of muscle activity here. In pre-swing, the critical event is 40 degrees of knee bend. So as that leg goes behind us, not a lot of muscle activity, the leg's just going behind, and that causes the knee to bend to 40 degrees. The hip is at 0, so the leg is starting to come back forward again, right? So in terminal stance, we saw the hip was in 20 degrees of extension. It was farther behind us. But now, because we're in swing limb advancement, right, the functional cadre swing limb advancement, we're working on bringing this leg back forward for the next step. Now we see the hip has flexed 20 degrees, so it's back to 0 rather than being in 20 degrees of extension. Our knee is at 40 degrees of flexion, and our ankle is now pointed. It's in plantar flexion because we're going through push-off. We're pushing off the ground, so we have to point our ankle to be able to do that. Okay, so that's pre-swing. What you're really looking for is a knee flexion angle of around 40 degrees. Then we're going to go, okay, so from pre-swing to initial swing, we have all these concentric contractions. We've got to pull our leg forward for the next step. So our hip flexors are going to contract to pull our hip into flexion. Our knee flexors, our hamstrings, are contracting to bend our knees so we don't catch our foot on the ground. And the same with our ankle dorsiflexors. We're contracting those to lift our toes so we don't trip by catching our toes on the ground. So all of those happen to get us to initial swing. Okay, so we went from pre-swing to initial swing. All of those muscles I just mentioned were contracting to pull the femur forward. We have to use the hamstrings here to bend the knee and the dorsiflexors to lift the toes so we don't catch the ground. This is where we see the most bend of the knee in Gait, 60 degrees. You need 60 degrees of knee bend, knee flexion to clear the ground when you're swinging your leg forward. The hip is now at 10 degrees of flexion. It's moved forward from 0. The knee is at 60 degrees, which is that critical event. And the ankle is in 5 degrees of plantar flexion. It's still pointed just a little bit. Remember back here it was pointed at 20 in pre-swing. Now it's pointed at 5. So we've used our ankle dorsiflexors to pull the ankle up, lift the toes, getting ready to step forward so we don't catch the ground. Okay, so from initial swing to mid swing, we're going to see the same exact muscle activity. Those muscles, hip flexors, knee extensors, and dorsiflexors, are all going to keep working to continue to pull the leg forward. Mid swing is where we said where the tibia is vertical. And here our hip is back to 20 degrees of flexion. We're getting ready to take that next step. We're close. Our hip is in the angle it needs to be. Our knee is still flexed at 30 degrees and our ankle is at 0 so we don't catch the ground. So all we've got left to do for our next step is to straighten the knee. So you probably can guess it. If you go from mid swing to terminal swing, what muscle would you have to contract to get your knee straight? Well, you'd have to contract your knee extensors concentrically, your quads. So you've got to squeeze your quads to pull your knee straight. Your hip extensors switch to eccentric because they're acting like a brake and they're slowing the movement down so we can take our next step. If you've ever had a hamstring strain, this is where you'll feel it. Right as you're swinging that leg forward for the next step, as your hamstrings contract eccentrically to slow down that movement, you will feel the pain if you have a hamstring strain. And the ankle dorsiflexors are still working isometrically here to keep the foot off of the ground so that we don't trip, but also we're getting ready for heel strike. So they're keeping us at that 90-degree angle. And then we get a terminal swing. So we're just about to hit the ground. We're a second or, we're just a few milliseconds before hitting the ground here. The really critical event of terminal swing is knee extension to neutral. People who have had knee surgery who are struggling to get their knee extension, this is where you'll often see they lack a few degrees. And because of that, they won't be able to get their knee straight, which means they won't be able to heel strike normally. So that's something you want to look for in people who've had knee surgery, is that they can straighten their knee all the way so they can heel strike normally and have a normal terminal swing and normal initial contact. So this looks exactly like initial contact, it's just that the foot hasn't hit the ground. Knee is straight, hips in 20 degrees of flexion, ankles back at neutral. That's one gait cycle. So I know it's a lot and it's pretty fast, but that's the whole thing. We went through all 8 events, talked about the range of motion and the muscle activity, and that got us from the left leg starting the gait cycle to the end of the gait cycle. So those are how all the events break down. So again, go back through this one. This was 30 minutes or something. I just went through this whole lecture. Normally in class there'd be questions and we talk about it, and we'd usually spend 2 or 3 hours on this in a normal semester. So don't feel bad if you're just like overwhelmed. I almost thought about breaking this up into 2 lectures because it's just a lot of information. So just go back, watch this again, leave me some comments if you have any questions about it, and I hope everyone enjoyed the biomechanics series. I may do some of my other classes on YouTube. I had a pain science class and a therapeutic exercise class, so maybe I'll put those lectures up and do new classes on here. But if you watched through all these, I really appreciate it. Thanks for doing this, checking these out. I'm glad people found them to be valuable, and I will see y'all later. Bye.